Welcome everyone, this is Yasser Wasifi from Learn Dental series. In this episode, we will continue our discussion about indirect tooth colored restoration. I would like to declare that I don't receive fees, compensation, or royalties from the sales of any of the products shown or discussed in this presentation, and this presentation is not sponsored by any company, agency, or organization and only prepared for educational purposes. This presentation is copyright protected and could not be transmitted by any means without prior permission of the author. In this episode, we will identify and discuss different techniques and types of indirect tooth colored restoration. Already in part 1, we discussed advantage, disadvantage, indication, contraindication, and the cavity preparation for indirect tooth colored restoration. And now we will discuss all the details of types and classification of indirect tooth colored restoration. Actually, we have two main categories according to the material that you are intended to use. Either you will use composite resin restoration or ceramics. Composite resin restoration could be classified according to the technique into direct, indirect technique, and chairside or flexible die technique, and also called semi-direct technique. For ceramics, it is either filled specific porcelain inlay and onlays, the oldest one. Then came the castable glass decor and hot pressed ceramic, and finally machined ceramics. Machined ceramics are subcategorized according to the type of your impression. Either it is an optical impression like that for Circ system, or a tracer like CLA system, or a complete optical scanner from 3 dimensions like Kevo Architica system. All of these are just examples for different types of impressions. Let us start with composite resin material and start with the direct indirect technique. It is as old as the early 1980s. Okay, it is just a construction of inlay, okay, and done inside the oral cavity, then go for a post curing outside the oral cavity. And the objective of this technique is just to provide patient with the benefits of looted restoration without the cost of indirect lab made or inlays or inlays. It was the first idea just to increase the properties or advance the properties of your composite resin restoration, and in a trial to reduce the polymerization shrinkage stresses intraorally. It's a very simple one: cavity preparation and lining for blocking of any undercut. Then composite resin is incrementally packed to overcome polymerization shrinkage, but it is not bonded to the tooth structure. That's why the restoration is removed for post-curing and finishing, and then cemented into place with bonding system. To remove your restoration, this is the trick in your technique. Okay, the inlay is removed from the preparation using a scaler, which is gently placed interproximal with great care to avoid marginal affection or marginal damage. If it is impossible or it is hard to remove it with a scaler, sometimes a loop with dental floss is made and is cured with a piece of composite to the occlusal surface to act like a handle. Okay, just to remove it with the explorer, hang it with your explorer and trying to push it out. Okay, this will serve as a handle that will allow removal of your composite. Then comes the phase of post-curing. Your inlay is covered with OxyGuard to prevent oxygen inhibited layer and receiving light curing for additional 60 seconds. Okay, just a full minute from each side. Okay, and then tempered in a special tempering oven to be heat cured at 110 degrees centigrade for 7 minutes. If you would like to report about this technique, you only trying to improve the quality of your composite material, but you didn't get the benefits of full indirect technique by great access and convenience in building your shades, on building buccal, lingual, and proximal contours. Okay, all of these, there is no benefits of this. It was considered as just a trial to improve the physical and mechanical properties of your composite. Then it drives the manufacturers, okay, and researchers to develop the fully indirect technique. In the fully indirect technique, the material is built up and completely fabricated outside your cavity. Your roll is just stopped at the level of taking elastomeric impression. Okay, then your roll come back when you are in cementing your restoration. Indirect techniques including cavity preparation and lining if needed, impression taking using elastomeric impression material for the preparation and for the opposing arch also. Then comes temporary or provisional restoration. The temporary is an important procedure because don't forget that indirect restoration is mainly indicated in extensive, badly broken down teeth or extensively damaged by caries or any another cause. Okay, that's why you are in need to protect your tooth until you finish your restoration that requires at least 2 visits, okay, with a time gap in between. That's why either you use non-eugenol temporary cement ready-made, which should be with low solubility and hard enough to protect your tooth structure, or you may use a customized temporary restoration like that of ProTemp for full coverage. Then you should pour your impression with fast setting stone and prepare your cast. Okay, sometimes your impression could be poured again to have a working die and a master die to adjust your or to check and verify your restoration. Then comes inlay construction. Before inlay construction, all margins of your preparation at the die should be marked with red pencil. Why red pencil? Because when you are trying to finish your restoration, sometimes you couldn't note due to proper and accurate shade matching. Okay, when you are placing it into the prepared cavity, you may miss any marginal flashes and could not differentiate between tooth structure and flashes of your composite. That's why your margins should be marked with red pencils, with pencil which will mark or print its red color to the margins of your restoration, and you know where to cut and where is the excess. Then separating medium is applied and the composite is built incrementally as usual, but this is not because of control of polymerization shrinkage, and this is not because of you are in need to increase adaptation, but you are incrementally packing it in order to properly reproduce the color. You use each increment with whatever the color, is it a dentine color, enamel color, is it a base, okay, and also to get properly polymerized by light from all directions. Then further heat treatment is done using a special oven for 15 minutes at 100 degree centigrade under moist condition with sufficient pressure. In this time, if you review what type of curing you are using, you used number one, initial visible light polymerization just to hold your increment, followed by heat treatment, followed by pressure. Then the cured composite inlay or onlay is allowed to cool before final trimming and finishing. Let us review this case. I think we already viewed 2 pictures or 2 photos from it. Okay, in such a case, this is an extensive carious lesion and defective amalgam restoration after removal of defective tooth structure and defective restoration. This was the remaining of your tooth structure. Then coming the lining and the blocking out of undercuts, we are supporting the very thin enamel margins. Okay, you could note how much your preparation having a rounded line angles, okay, and how much is the thickness of your reduction, which is suitable for the physical properties of the material as being considered brittle. Then comes the die construction, and this die, on this die, a minor undercuts are observed and blocked out with wax. Then building up your base material just to act as an opaquer, okay? Then building up dentine, then building up enamel, okay? And those are the finished restorations after adding characterization and stains within your fissures. And this is the final cemented restoration, and this is from the buccal view, and this is after complete removal of your rubber dam, and this is the case before and after. Another case where you could note in this die where is the marked margins with red pencil, okay, blocking out of undercut with wax also, and this is the base dentine, it's much more obvious, and this is the dentine structure which forming the loop of your missed cusp, and this is a cross section showing that the layering or incremental building of dentine structure then followed by enamel structure, and this is the case after initial light curing. You could note the importance of red pencil marking of the margins that allows you to definitely define where to stop your building and where to stop your finishing. This is different types of furnace used. The right one showing A and B. A is an command light curing for lab work that cured each increment. Then comes the other furnace, which includes pressure, intensive light, okay, and heat for complete post curing. This is the complete indirect technique. Then to simplify the procedure, a chairside flexible die technique is introduced into the field of indirect two-scalar restorations. Okay, it is basically an indirect technique, but the steps are made using a special silicone rubber die material. It's a special material, not the commonly used rubber-based impression. And the composite material is built up incrementally and cured initially and conventionally by conventional light curing, then followed by further light activation in a special light curing unit. And the technique could be made in front of your patient if you have enough time, and could be finished as a chairside technique. Okay, let us discuss two cases. This is one of them: removal of all the restoration, okay, failed GIC and extensively damaged first molar, and after removal of defective restoration, then impression is taken and poured with special silicone base material, and it is cut into removable die using a lancet. Then the composite is built also incrementally, okay, forming the dentine structure shade or the dentine structure, then covered by enamel one, then characterization, okay, and this is the finished case, and this is the case after complete cementation. In the coming video, we could note this technique, shade selection, okay, the operator here selected to use alginate impression and poured it with a special, this is a logo brick that will be used just to identify the position of your removable die. It's simply like that for die lock tray used for forming removable die to construct wax pattern. This is the model material or the silicone die material, not the silicone impression, okay, and you should pour your impression carefully to avoid formation of any of air voids, okay, starting from the corners, okay. It's a flowy material to fill all your impression. This is the logo brick that will act as a reference for you for this removable die, and this is the removable die, which is formed of silicone rubber. Now all the excess materials are trimmed with sharp lancet to prepare for removable die, and then the tooth is cut to form a removable die. Okay, you could note the stiffness of the rubber die material, okay, touching of the margin, for clarifying the margin. Okay, this also will help you and provide you with greater accessibility for interproximal area. Okay, and your reference will be the logo brick that will replacing, as you could note here, okay, your die in its place. Okay, in such technique you are not in need to use separating medium, okay, because your composite will not adhere to the die, and now he's starting to build the dentine shade. And curing it. The thickness of this increment, okay, will not exceed or should not exceed 2 millimeters. Okay, then trying to build the proximal area. With the selected shade, continuing to the shade of dentine, then comes the enamel shade, and the operator here or the technician continue to build the missing cusp, okay, checking it and marginal adaptation from all sides, blending with brush and wetting agent if supplied with your kit. In such a condition, don't forget to have a reference for your occlusion by taking impression for the opposing to check your occlusion. Okay, he is now building the proximal wall and ensuring proper marginal adaptation at the gingival floor, also contouring of the proximal wall and contact area. Okay, that will be checked now to be positive and placed in its proper position by placing the neighboring one, blending with a brush, curing, continue building of the marginal ridge and occlusal embrasure. It is just similar to that of building composite resin restoration by direct technique, but it's much more accessible than that to build it intraoral. Coming back to dentine color, okay, trying to make a guide for your grooves, okay, and these grooves, maybe he will use a characterization or stains. Yes, he used characterization to fill these grooves. To be above the layer of dentine, then covered by a layer of enamel. This will allow that the shade of these grooves will come from inside to outside, okay, which produces a much more beautiful appearance. Then chromatic enamel shade is used finally to finalize building the loops which forms the cusps. Each one is cured separately. It's very easy to apply, but the problem is you should have sufficient time to build it accurately. I think you could note how the operator or this lab technician having a good idea about the anatomy of the tooth. You should have a full knowledge about the anatomical form of the tooth. What are the loops, where it starts, okay, cusp inclined planes, okay, and also the sequence is important, which cusp I should start with and why, okay. But also I believe that practice makes perfect, okay. Needs too much practice, okay. Take your time to train it, okay. Because this is not only improving your skills in preparing indirect restoration, but also for direct build-up of your composite resin. You are in need to have many dummies, many plastic teeth, artificial teeth to train how to rebuild and what is the guidelines to rebuild your anatomical form. Some operators and some students believe that you are in need to be an artist to make this. No, it's just a training procedure. Take your time and it will come easy. Doesn't need to be an artist to build it, just you have enough knowledge about the anatomy, like our friend now, okay, he knows quite well where to place the groove and supplemental grooves, okay, and that's it. You could try it with wax to train yourself, then try it with composite, just not to waste too much material. Wax is easier to be used in your training until a certain degree of perfectionism you could get it, okay, and then try with composite itself just to know the material, how it senses the sense of tactile sense with your material. No need to use separating medium, and now additional light curing, and now it's easy to remove it and re-cure it again from the fitting surface, no matter if you increase the time of curing as much as you would like, okay, to ensure proper curing from all sides. Then using the normal finishing kits to finish your composite and polish it easily with abrasive rubber kit. And this is the finished restoration. Is trying to finish it to accurate margin, removing any flashes. This is to refine again your rubber tip, because when you are using this rubber abrasive, unfortunately it gets much more broader and you need it to be very fine tipped to finish and polish your grooves using silicone carbide brush without any polishing paste at low speed to get this luster of your composite due to smoothing of the surface. Okay, and examine the restoration from all aspects. You get all the benefits of the indirect technique, and at the same time then you are to intraorally place it. You could use a micro brush with just a drop of bonding agent curing it, just to handle it easily and to place it intraorally. But the problem is in our flexible die technique that composite resin is backed and built against a flexible die material. The marginal accuracy of the inlay may be questionable in some techniques. It differs according to the degree of stiffness of your rubber. Okay, and that's why sometimes the margins are not so accurate intraorally like that on your flexible die. For flexible die working cast, you are not in need for separating medium, nor as a material will not susceptible to breakage, okay, and the chance for chipping of restoration upon removal from working cast is slight or nil because it's rubbery one. Once you are stretching it, you could notice how much easier it could be removed from the die material. Finally, those are the articles I used. If you would like to have much more reading about this topic, and in next episode we will discuss the second type, which is the ceramics as indirect use restoratives. It's about 16 articles, and those are the textbooks I used in preparing this presentation. Finally, feel free to ask me, as your questions are welcomed all the time. You could ask me by commenting to this video and I will reply to you as soon as possible. Please don't forget to like this video, subscribe to my channel and activate notification to get all the updates of my channel. Finally, thank you for assigning this time to listen to me, and goodbye until we meet again. Thank you. Yasser Al-Wasifi.